Ruth Maguire.
Thank you, Presiding Officer. To ask the Scottish Government what action it's taking to ensure that women who need it have access to specialist services for advice and support on the diagnosis and management of menopause.
Minister Marie Todd.
We are determined to ensure that women are able to access the care and support they need for menopause, be that through primary or specialist care. There is now a specialist menopause service in every mainland NHS board and support in place for the island health boards. A menopause specialist network meets regularly to provide consistent advice and peer support to healthcare professionals, including primary care teams. We know that many women will seek support from their local GP practice for their menopause symptoms. To support primary care, NHS Education for Scotland is developing menopause training for healthcare professionals, including practice nurses and GPs. And support for women experiencing the menopause will continue to be a priority for the Women's Health Plan as it's implemented.
Ruth Maguire.
I thank the Minister for that action. HRT is part of the jigsaw of management of menopause, and for many women it provides invaluable relief from the quite debilitating symptoms of menopause. Those women will be concerned about reported shortages of HRT. Can I ask the Minister what this current situation is in Scotland, and further to that, if she would consider enabling pharmacists to prescribe HRT so that where there are shortages, women can be advised on and provided with an alternative at the time rather than returning to their GP?
Minister.
I'm grateful for that question. Community pharmacists in Scotland are able to make appropriate generic or branded substitutions by endorsing for a change of strength or quantity if alternative products are available. Pharmacists who are independent prescribers can prescribe items within their clinical competency, and we are committed to expand the number of community pharmacists undertaking independent prescribing qualifications and have invested in a programme to support this. In addition, serious shortage protocols, SSPs, which can apply to the whole of the UK, are used for serious shortages when medicines are likely to be unavailable for some time. So 3 SSPs were introduced across the UK on the 29th of April 2022. Community pharmacists can limit the supply to 3 months in accordance with the SSP for eligible patients to help conserve stock and to ensure that as many patients as possible are able to have access to their prescribed medicine.